Welcome to Sandwich Seniority. I'm your host, Robbie Haig, and today I'll be talking with Sonja Brewer, who is the Regional Shine Director for Cape Cod and the Islands. Welcome to the show, Sonja.
Thank you very much. I appreciate being here.
Very nice to have you here.
Thank you.
And why don't you begin by telling a little bit about yourself?
Well, about me, I've been residing on the Cape for about 27 years. Many years ago, I used to live in Sandwich.
Oh, very good.
But I now I have lived in Yarmouth Port and Dennis, so mostly the Mid-Cape area. And I've worked for nonprofits in the town of Barnstable, and I've been with the Shine program now for 2.5 years, and love the work.
Oh, good.
It's a great program.
Very good. Tell us about the Shine program. What's it all about?
Well, the Shine program is a program that supports Medicare beneficiaries by providing them with education and information so that they can make informed decisions about their Medicare insurance options and coverages. Mm-hmm. And so we exist basically to support two groups of people who are Medicare beneficiaries. One would be someone who becomes eligible for Medicare by virtue of turning age 65.
Okay.
And the other would be a group of disabled adults who, because they've been on SSDI for 24 months, they then become eligible for Medicare. And it can be a confusing change for them as well.
Sure. So that's
really
over when they become...
Could be someone age 24 who could be on SSDI.
But they generally are not under 22, is that correct?
Correct. Okay. Yes.
Very good. And what does SHINE stand for?
Oh, good question. We are, it's an acronym. It's Serving the Health Information Needs of Elders. And we are a national program funded federally through the Centers for Medicare and Medicaid Services. Okay. But in many other states, we're known as the SHIP program rather than the SHINE program.
Oh, really?
So, you know, someone with a brother or sister in a different state might know us under a different name.
Sure.
Yeah.
Oh, very good. So what actually is the SHINE program? What do you do?
Well, we consist of mostly volunteers. These are my counselors, my SHINE counselors are certified by the state of Massachusetts. They take a very rigorous training to become SHINE counselors, and they have to attend monthly trainings throughout the year, and they become recertified by state exam every year.
Wow.
So you can be assured that the people that you talk to really know the material.
They know what they're talking about.
Yeah, it's complicated material. You know, it's very technical. And I have 45 counselors. About 80% are volunteers.
Wow.
Yeah, we're in nearly
fantastic.
every town. We're located at the senior centers for the most part, also some of the community health centers. If you wanted to contact a SHINE counselor to discuss your personal situation, would encourage people to do that. We love to sit one-on-one with people or sit with a couple and go through, you know, what is your insurance now? What have you been thinking about? What's a problem for you financially? What can we look at as alternatives for you? But my counselors, the counselor group, particularly the volunteers, very dedicated people from the community who
have to be.
Most of whom they've come from some professional job and they don't want to let their minds just rest. They will learn this technical material and they're very good at it.
And the Medicare booklet itself is dramatic.
Yeah.
You know, it's totally intimidating.
Oh, I've had, you know, professors and lawyers call our office and say, apologize actually for not understanding the material, and I have to tell them, you're not alone. You're just not alone. It is complex, and
and I don't think it should be.
Well,
by virtue of the people who are needing it.
Right.
You know?
And it can be logically and sequentially explained. It's just that often that's not how it's presented. So we do some work to make sure that the format that we give to people to explain their Medicare benefits makes sense to you.
Good.
Yeah.
Very good. So how does one go about getting information from you, you know, knowing who you are and knowing what information they need?
Well, anyone can contact us through the regional office as one alternative.
And where is your regional?
Well, we're housed at the Town of Yarmouth Senior Center.
Okay.
That's where the regional office is located. But as I said, I have certified Shine counselors in nearly every senior center.
Yeah.
So you would call your local senior center and ask for an appointment with the Shine representative. In some cases, you'll receive a call back and we'll talk on the phone, and in other cases, we'll make a direct appointment with you to come in to the office and sit down one-on-one with a Shine counselor. And that's basically how we arrange for appointments. We can do quite a lot of work on the phone, but sometimes it's good to show you the materials, to actually show you the names of different companies that are available, and actually sit and do cost analysis with you at the table.
Now, do you find that when people go on Medicare, they're apt to contact you to see what it's all about, or do they wait until there's a problem?
Well, both, I'd say. There are a number of people who are very educated, and they pre-plan, and they know they're turning 65 and they're going to be eligible for benefits, so they'll contact us maybe 6 months ahead. It's a little early, but that's fine. And others who will come with a basket full or a pocketbook full of bills that they don't understand, that they owe money for, and now they're very stressed and anxious. So we really see both.
Yeah. So you go over the bills with them and then talk to them about how they can lower their fees to these?
Right, we would make sure that what they're being charged makes sense. Some people forget that they might have not yet paid an annual deductible on Part B, or an annual deductible that belongs to their prescription drug plan. And they see the doctor in January or February, and suddenly they have a bill that maybe a service that they've received before, and it didn't cost them anything because they were well past that original deductible for the year.
Right, sure.
And they forget, so we'll remind them.
Would you be kind enough to just, and this just hit me off the top of my head, to talk about what Part A, Part B,
if I went into detail, we'd be here a couple of days.
I wouldn't want
this is
you to
a
go
very,
into detail.
very, very brief
Yes.
overview. Part A, Medicare covers hospitalization. That's how we easily refer to Part A. And it's your right. It does not cost anything. There's no premium for Part A unless you didn't have enough quarters worked under Social Security. Then you could purchase into Part A. Most people don't pay anything for Part A. And Part A can provide a very substantial hospitalization, very up to 20 days of skilled nursing care with no copay. There is an annual deductible. No, I'm sorry, it's not an annual deductible. It's a deductible by benefit period. Some things you learn about how technically Medicare works, and that's rather high. That's $1,156. Which pales in comparison to a $30,000 hospital bill, but it's still a hardship for people.
Sure.
So that's basically Part A. Part B are your doctor's charges and diagnostic tests and durable medical equipment. So you see the doctor and you buy into Part B. Right now, everyone is paying the same amount for their monthly premium for Part B unless they're at a high income level. Most people are paying $99.90 a month. And, again, they tend to forget that they're paying it because it comes out of the Social Security check if they're receiving Social Security payments. After that, there's a $140 deductible for Part B on an annual basis, and Medicare will cover 80% of the cost of those doctor's visits. You are responsible for 20%. So then we would look at someone and want to know, what are your medical, we don't necessarily need to know what your medical conditions are, but we need to know, are you somebody who frequently goes to the doctor, who may have chronic medical conditions and you need to see specialists, may have to have periodic diagnostic testing, may need MRIs or x-rays, they can get very expensive. And what we're doing is trying to assess whether or not you would benefit from a supplementary insurance or from a different type of insurance called managed care, which would be a HMO or PPO type of plan, and would help you get that additional insurance, or at least to understand it. We do a lot of work with people on prescription drugs.
Yeah.
It is the highest exposure area for costs for seniors particularly. And unfortunately so. We see people who are aging and their drug list expands with their age, unfortunately.
Right.
And some of the drug costs are horribly expensive. So we work with individuals to find the best drug plan. There are unfortunately 30 standalone Part D prescription drug plans in the state of Massachusetts.
Wow.
And that is a very difficult decision, and one that you don't just choose a plan based on a premium.
Right.
You take all the costs and the particular list of drugs, the dosages, what pharmacy they like to shop at, whether or not they use mail order. There's so many things that feed into it. We actually save people on average. This is on it. Not everyone will save. Some will save more, some will save less. But on average, for the people we spend 45 minutes with, we will save them $1,000 a year. So it's well worth your time to make an appointment with the Shine program.
Well spent.
Yes, absolutely.
Really?
Yeah.
Wow. Yeah. So, how would someone get assistance? Just by making that phone call to the
making
council?
the initial contact to the Shine program. I had, as an example, I had a younger woman call me a few days ago. She was actually an adult disabled, becoming eligible for Medicare, made enough money where she was not going to be eligible for public assistance like Mass Health. And interestingly enough, many people are eligible for Mass Health and may not know it. In this case, she wasn't eligible. She needed help choosing a prescription drug plan. So we talked on the phone. What was her circumstances? She's had an anxiety condition and did not want to come into the office. So that was fine. I asked her to mail.
Everyone's unique.
Yeah, I asked her to mail her drug list in, and my assistant actually ran the search on the Medicare website. There's a tool called the Plan Finder, and it lets you put in all your medications and your dosages, and it tumbles those 30 plans and finds the most affordable plans for you.
My goodness.
So we did that, and when I called her back, she said, well, there's one more medication that she was going to be getting a prescription for, and would I add that? And when I added that one medication, it totally changed the picture, and another plan was the more appropriate plan for her. So it really does pay to do the homework to figure this out. And I mailed her our recommendations, so we were able to help her.
Wow. Some of the most common types of assistance that you
again, I would say prescription drugs would be the area where we help people the most. There are things like, I'll give an example. This is the state's pharmaceutical discount program. It's called Prescription Advantage.
Okay.
It's a rather underutilized benefit plan for moderate income people. It doesn't look at your assets. You could have a trust, you could have money in pensions and IRA accounts, and this plan will not look at that. It will look at your income, and as I said, it benefits even moderate income levels. And what it can do is, you've heard of the proverbial donut hole. And,
yes.
Yeah, Part D. Well, this plan can actually limit people's costs if they do hit the donut hole, so it can reduce their copays for their medications, both for generic and brand name medications. It can also give them the opportunity to change a Part D or a prescription drug coverage one time in the middle of the year when everyone else may be stuck and has to make a change through open enrollment. This plan can free you up in the middle of the year to make an appropriate change to reduce your costs. So that's an example. We have people who need public assistance. They're very, very limited income. And they may not realize that there's another program called the Limited Income Subsidy that can help with prescription drug costs. There is, as I said, Mass Health. And on the Cape, we have a number of aging couples with chronic conditions, and they need help in the home, or they need help transitioning to a nursing home. And what public assistance is out there that can help them? And who is the agency that they should be talking with? So we do quite a collaboration with Elder Services, as an example, with the VNA. We actually help people with mass health applications for long-term care, not insurance, but long-term care coverage
Sure.
under mass health, Medicaid. So it's a lot of programs that we know about and can recommend. And I'd say that's where we do most of our work, is helping people afford their insurance.
And you mentioned open enrollment.
Yes, open enrollment. The dates have changed.
Okay.
As of last year, the dates changed, so it's now a little earlier in the year. And so it's October 15th to December 7th.
Okay. And what does that mean, open
Well,
enrollment?
actually, it means that you can, if you have prescription drug coverage, you can change your plan effective January 1st. If you have a Medicare Advantage plan, you can change your plan January 1st. So those are
of
really...
the coming year?
Yes, of the coming year. So we're looking at 2013.
Okay.
And what happens is, about right at the beginning of October, the SHINE counselors will be updated by the state as to all the plans that will be available in 2013. Wow. So we don't get a lot of a head start, but we get a little bit of a head start, so we know what's out there and we can help people.
And would you like to talk a little bit about what type of education a new SHINE member receives?
A SHINE counselor?
SHINE counselor.
SHINE counselor would attend a 10 to 12 day training, full day. I'm actually running a course right now for Martha's Vineyard prospective new counselors.
Wow.
And they'll cover all the basics of Medicare. Also things like, how do you file an appeal? What's the difference between fraud and abuse? How would you recognize it? How does somebody get notified of their bills under Medicare, and how do they know what's correct and where to look on a summary notice? They get instructions on public assistance programs. Preventive care is a big area under Medicare now. There's quite a bit of a change in terms of approaching health care through wellness objectives rather than just through curative therapeutic approaches. So we get some grounding in what's the normal course of preventive care treatments, and many programs now, many screenings don't have a cost associated with them under Medicare, so that's very important information to get out to the public. So they really cover quite a number of areas.
And that's extensive education, and then
Oh,
they
it
are
is.
updated on a monthly basis?
On a monthly basis, yes. I have a training meeting coming on Monday afternoon this next week. And
So it's a wonderful thing these SHINE volunteers do.
It's a great benefit to the community. It truly is. It's one of the best programs I think I've ever been associated with.
Very, very well educated.
Yeah.
Now, you have volunteers who are counselors.
Yes.
And do you, how can I put this kindly, do you have enough help?
Never enough help.
Okay, all right.
Because the program requires extensive training. We don't run constant training courses.
Okay.
And it's a little difficult for people to get off the Cape and get to a training somewhere in Massachusetts.
Okay.
There are usually training programs going on every spring. This year, I will be running a training program in the middle of the summer, which is not the best time for some people, and for others it's a great time.
Well, for on Cape, it might be a good time.
Well, and it's good because it'll be right before our next open enrollment, so people will be having a chance to be mentored and ready to counsel new clients.
So your volunteers are all in every town on the Cape?
Pretty much. We lose people periodically. They have other things to do in their lives, so
Really?
we understand that. So sometimes we're a little depleted in certain areas. A few years ago, we had very few people out in the Outer Cape, and now we have at least 3 on the Outer Cape.
Okay.
So that's a good change, but we could use probably another person out there.
So you don't have one per town, do you?
Sometimes it's 2 per town, sometimes
Okay.
it's 4 per town.
Oh,
It's
depending upon the size?
Right, exactly.
And you did say that you were doing a training in Martha's Vineyard?
Yes, I'm doing that right now, and the new class, if anyone's interested, would start on July 16th, and they can contact us in the Yarmouth Regional Office.
Good.
If I can give the phone number, it's 508
Please do.
394-9326. and that will reach us in the Yarmouth Regional Office, and we'll be happy to take down your name and your information and talk to you about becoming a prospective Shine counselor. It is unbelievably rewarding work.
Excellent. Are there any qualifications for these people who would?
You know, we look for people who have, you know, basically done something effective in their lives. You know, many of them have come from medical, business. I like having people from business with a non-medical background, particularly because it helps me to gauge the effectiveness of my training.
Oh, very good.
But I do have attorneys who take the course and outreach workers who are, you know, very well schooled on lots of assistance programs for seniors. So we really have quite a variety of people.
Mm-hmm. But there is a certain age? Or?
No, oh, not at all. Not at all.
Excellent.
I have, you know, some aging counselors, very great number of them, and younger counselors as well. And I welcome everyone.
That's fantastic. What are some of the things that people are often surprised to learn about their health care options?
So many things. There are the providers of what we call Medigap Insurance in the state of Massachusetts. This is the supplementary insurance that I referred to earlier.
Right. Yeah.
There are only 6 providers, and there are only 2 levels of Medigap coverage. And despite some minor differences, all the companies offer the same coverage. So what you're looking at is monthly cost differences, and you kind of have to scratch your head at why are they different? And what we say to people is, you know, it's your comfort level with that name. They're major name companies, Blue Cross and Tufts, Harvard Pilgrim, Fallon, and so forth. Your comfort level with those companies, perhaps you've had some exposure to their customer service, but when you choose a plan, you're choosing the content of the plan, what it offers you, and these plans are virtually identical from provider to provider.
Oh.
That's something people don't know.
That's amazing.
Yeah, and I think the other thing they don't know is that type of insurance, supplemental, you can pick up at any time of the year. We have continuous open enrollment for those types of plans, in all providers in our area offer continuous open enrollment. So if you were to enroll today, you would be effective June 1st.
Okay.
So you don't have to wait until the next open enrollment to pick up that insurance.
Very good.
And that can help you pay that 20% when you see the doctor.
Okay, that was my next question.
Yeah.
The Medigap is that 20% that is not paid by Medicare.
Right, exactly. Both levels of plans offer coverage for the 20% that Medicare does not cover. Yeah. And the higher level of coverage will cover that hospitalization deductible that I originally mentioned.
Right.
So you would have full protection. It offers quite a number of other things, but those are the two big areas that people are really looking for help on.
And the donut hole has to do with medication, am I correct?
Yes, prescription drugs. And that's after your retail cost of your drugs, starting on January 1st, has reached over $2,900 in the year. And that's not what you pay, it's the cost of the medication.
Oh,
so you can get there pretty quickly.
That's another thing that's very interesting.
Right.
The cost of the medication.
But things are moving in a positive direction under healthcare reform. We have now some assistance for people who do hit the donut hole. After they reach that plateau, they are now going to be responsible for a higher cost of their medications. So it's kind of reverse logic that if you're going to spend a lot on medications, you're going to reach the donut hole and spend even more. Doesn't seem quite fair.
No, it doesn't. It does. It's hard to get my head around that
it
too.
It is, yeah.
Because it's like the medication. You were saying that it's the cost of the medication and not what you pay for it.
Correct. It is the cost of the medication.
So you pay more of the cost of the medication.
Correct.
In the donut hole.
In the donut hole. And what it basically does is it limits the cost on behalf of the insurers.
Okay.
So yes, that makes it more understandable.
And it does make it more understandable because, you know, people hear the donut hole and I think their eyes glaze over.
Well, and it's a scary proposition to, when you're on a fixed income, to reach some point in the year where suddenly you now have a higher cost.
Right.
So we're seeing more coverage of medications in the donut hole, and that started really last year. We're seeing a percentage of the generic drugs now covered. 14% of the cost of generic drugs are now covered in the donut hole. 50% of brand name drugs, which are the more expensive drugs generally, are now covered in the donut hole. And as years go by, we will slowly close that gap, and the donut hole will disappear, which is great news. Great news.
Very good.
Yeah.
Doesn't it just boggle your mind that medications are so costly?
Oh, yes, it does. Yes. Yeah.
It does mine too. Is there anything else that you would like to leave us with regarding the SHINE
Well,
program?
two things. Basically, that the SHINE program is there for people to take advantage of, and would love to see more people take advantage of the services that we offer. We don't cost anything. We're happy to help.
Very good.
The other thing is there are many people who don't really realize what public assistance programs are out there, and as residents of the state of Massachusetts and residents of the United States, you know, we have a right to certain level of help based on our income and assets. So it's okay to look at these programs. It's really okay, and we're happy to help.
And you have so many people out there in the age group that are so obedient.
Exactly.
And they don't want to
to
bother anybody. Okay, well, it's wonderful hearing all of this information. I'm sure there are people out there who are going to, their eyes will glaze over, but maybe,
a little bit,
maybe they'll
we'll
contact you.
Try to help them through it, yeah.
Very good. I thank you very much for being part of Sandwich Seniority. I'm your host, Robbie Haig, and I hope to see you here again real soon. Thank you.